Hey, Linda, I'm so happy to have you again tonight. You're a fabulous dog trainer and behaviorist, and there are so many things we can go over how to be our pet's hero. How are you this evening?
I'm great. Thanks for having me back, Judith. This is great. Thank you.
Hey, that's awesome. Hey, I want to talk about something that I have close to my heart is cooperative care. So certainly cooperative care we see a huge number of pets. I still have a vet hospital. I'm still working as a clinician and a surgeon. We're seeing lots of pets, especially through COVID. I mean, our workload has increased, and yet, for example, I'm based in Calgary, we have a huge labor shortage. So we don't have a lot of staff to do all this. So what I'm finding out more and more is that certainly when a pet comes in, and if we have to deal with some issues, of course, around sickness, where we need to do blood work and x-rays and so on, whether at this clinic or at emergency, a dog can be handled easily by 4 to 6 different people in a 30-minute span, which is huge for a dog because it can be met by a receptionist, can be met by a vet assistant, and then a technician will help to do x-rays, the veterinarian will be involved, and there's another vet assistant coming in. So to me, that's very stressful for a pet to meet so many people in the span of 30 minutes and going through different procedures that they may be happy and not happy with, and they've never been conditioned for that. So can you explain a little bit from the point of view of a pet and how not to make things worse at our end, what pet owners can help a little bit? It's a very short overview. We're going to go into greater details later, but if you want to just give us a bit of an overview on this, that would be great on cooperative care.
Well, sure. The animal has no idea what you're doing and has no idea why it's in this strange place that smells weird. Maybe there's other dogs barking and stressed out. Maybe the animal doesn't feel well or he's in pain. And now all these strangers are putting their hands on him and doing some fairly invasive stuff. So from an animal's point of view, it's not a very pleasant place to be. And even one exposure to a fear-producing environment and set of stimuli can cause lifelong fear in an animal. So we really want to try to prevent that if possible. So cooperative care is basically working with your pet to teach your pet that these procedures aren't really scary, even though they might be somewhat invasive. And you're working with the pet to do stationing behaviors where the pet is standing still with its chin resting in your hand while the veterinarian or technician administers fluids or does a vaccination. It doesn't have to be held in a tight body hug, restraint, which is very scary for an animal. You can teach a dog to lie down in lateral recumbency on its side for an exam, to be used to having its ears handled, its eyes handled, so that it can stand there knowing that this is not such a scary procedure when the veterinarian has to look at their ears or whatever body part to get some kind of an idea of what's wrong with the animal. And cooperative care is very much a communication. It's a dialogue between the dog and the owner. And then you branch it out and have other people working with the dog too. So the dog gets used to other people touching their ears or their eyes. And by pairing it with treats and using a nice training procedure at home and then in the yard and then in maybe the waiting room of the veterinary clinic, without something really unpleasant happening, the dog gets used to this and is not so stressed out when he has to come in and have care done, real care done by the veterinarian and the team. So it makes everybody's job so much easier. Once an animal is afraid of a situation, if you push through and just get to the end, it's worse the next time. It doesn't get better, right? So
yeah. And we definitely see that for things like nail trims, where they haven't done well, they've been quicked before. I mean, it's getting worse and worse. It's so difficult. It's stressful for the animal. It's stressful for the vet team. And of course, it's stressful for the owner to witness that when there's been a bad experience, it doesn't come back to zero. We have to work at it. And unfortunately, again, in the span of 30 minutes, we don't really have time as the vet team. So it's really the owner, and I use the word owner because it's a legal definition for us, but it's really up to the owner to try to retrain, to bring it to a different level, right?
Yes. And so many of those things like nail trims can be done at home. where it's far less stressful for the animal. And, you know, it doesn't have to all be done at once. You know, you can work up to it nice and slow. You can basically change the animal's negative association with having its feet handled or its nails done to something fun. You can actually make it into a game, and work with your animal and improve the bond rather than forcing your animal to comply. It's, you know, very much a respect for me. We don't force children. We don't force our spouses into these things. We shouldn't really be forcing our animals into these things. And it can be dangerous. It can be dangerous for the veterinary staff. You know, some of these dogs are very big, and, you know, their only line of defense is their teeth. And really, we don't want to put our animals into that situation. You know, case in point, the zoo animals and the, you know, the nail care and tooth care that they have. You don't see people wrestling a rhino to the ground. You know, you
That's
can't.
right. Yeah, they've already been trained through session, and yeah, and I've seen with gorillas where they'll present their arm to get venipuncture done and everything. So it'd be nice if we could work our way there with pets that are owned.
It's very doable, and it's fun, and it's participatory, and it's consensual. It's all the good stuff. So yeah, I'm a super fan of cooperative care. It's my passion.
Oh, nice. And for us, certainly it's starting to be a bigger issue because dogs are getting bigger and bigger. Most of the dogs that we see at our vet hospital are probably anywhere between 60 and 150 pounds. So if one dog decides not to cooperate, we are in trouble. So, and of course, restraint is not our first option. Unfortunately, or fortunately, one of the options that we have to go to, which would be better not to, but it's to use a good sedation. So that the dog doesn't get stressed out by the procedure, and by the time they wake up from it, they actually remember nothing. But the idea would be to make it more that it's a cooperation between the two. You're on bed.
You can sedate for a necessary procedure and not stress the animal out, and not take steps back in your training. That's ideal, right? That's absolutely ideal.
Absolutely. So for example, for us to take x-rays, some dogs actually do not mind to go onto a weird table. I mean, it's a different table, it's a different room. Obviously it's a dark room. So some of the dogs don't mind to go on the x-ray table and be laid, we call it lateral recumbency, to be put on their side or be put on their back. Other dogs are panicking in there. So if that's the case with them and they're getting anxious, we give them an IV sedation. It'll take 5 minutes, and then we can reverse it, and then they wake up again with the owner not knowing what has happened. So for some more difficult procedures, it happen, but certainly other things where we have to put ear medication, eye medication, doing mouth exam. And certainly from a veterinarian point of view, I certainly appreciate when people give me a heads up. Hey, my dog doesn't like his back feet handled. Hey, my dog doesn't like his mouth looked at. So it's kind of nice to have a little bit of a heads up. So Linda, you're on Bandit Peak, mentoring.com. So if people need a one-on-one session to try to reverse a situation or make sure that we're starting with a good situation with a puppy, that's where we can find you, correct?
Yeah, absolutely. Yeah, we can start your puppy off on the right paw. And if you're having trouble with any of these, you know, husbandry tasks, these basic body care tasks, or you want to prep your dog for surgery or wearing a cone before the event, you know, we can always train that in advance. So yeah.
Smart one. I just hate to put a cone when an animal wakes up from surgery and they wake up in a cone, and that's not a happy situation. So it's so nice to actually pick up a cone a few days before and just make it a positive event. So when they wake up with it, it's already something they're used to, not an additional stress. Thank you so much. Yeah, one more thing. Thank you so much, and that was great again.
Thanks for having me. It was a pleasure as always, Judith. Have a good night.